Today I'm in front of one of the Phoenix points of pride called the Tovrea Castle. It was built back in 1928 by an Italian immigrant named Alessio Carrero. Alessio built the property on 277 acres that he purchased. It took him a couple years, and when it was done, he actually grew unhappy with some of the surrounding neighbors. They were having sheep and livestock pens, and he just wasn't happy with that, so he sold the property to the Tovrea family, who held it up until the 1990s, and then they sold it to the city of Phoenix. If you look at it, it looks like a three-tiered wedding cake. A lot of the residents here call it the wedding cake castle. It's very visible from the Loop 202, which is in the southern part of Phoenix. It's very attractive. Stands out like a beautiful sanctuary off the freeway. And the city's doing a great job of renovating it. They've been a little held up with the recession, but hopefully in the next year or so they'll finish getting it back to the lush desert botanical landscaping it used to have and open it up to the residents, for viewing it. At any rate, the topic for today, I wanted to talk about 10 conditions that medicinal marijuana works well for. In November 2010, the residents of the state of Arizona approved medicinal marijuana for legal usage. There were 13 qualifying conditions that the state has approved, and patients are now, as of April 2011, able to apply for their patient ID cards. The conditions that I wanted to discuss today, we'll just run through them. The first one is glaucoma. Glaucoma represents a condition where there's increased intraocular pressure in a patient's eye. Marijuana is a good second or third line treatment for that because it can decrease the intraocular pressure for about 4 to 6 hours, but for patients who have problems with their intraocular pressure, they're going to have it all the time. So it's better to have a baseline type of medication for that. Otherwise, you have to intake marijuana every like 4 to 6 hours, which can be a little bit cumbersome for folks. Another one that medicinal marijuana can be very good for is chronic pain. It's also one of the most abused indications for medicinal marijuana. The best indication for chronic pain is peripheral neuropathy types of issues. If a patient has had surgery that technically went fine but still has pain either in one of the legs or both or their arms, medicinal marijuana can work very well for that. Diabetic neuropathy types of issues where there is no surgical cure and medicines don't work really, really well for that. Opiates don't work great for peripheral neuropathies, maybe phantom limb pain, those types of things. So that's the best indication for chronic pain. There are others as well. HIV and AIDS. Patients who have HIV and AIDS have big problems with losing weight. The medications that they take, that they need to take, are extremely debilitating to patients. They can cause cachexia or wasting syndrome. So medicinal marijuana can help increase appetite and keep on weight. It can allow patients to gain 40 to 50 pounds of weight that they need for nutrition and lean body mass. So that same indication is good for severe nausea and vomiting, such as for cancer chemotherapy or radiation therapy. That's another indication. Another one is seizures. It can help with the prevention of seizures. Another one is muscle spasms that are severe. So if someone has a spinal cord injury that's either incomplete or complete, they can have issues with muscle spasms. Same thing with multiple sclerosis. Have big time problems with muscle spasms. Medicinal marijuana can work extremely well to decrease that issue. Another indication is agitation of Alzheimer's disease. Alzheimer's patients can get very agitated and they can have problems with tremors and muscle spasms as well. Medicinal marijuana can be very effective for calming those patients down and allowing them to somewhat function. If the Alzheimer's, is not too bad, they may be lucid at times, so it can be very effective. A couple more. One of the indications that we see is for cancer pain. There was a study done at the University of Iowa showing that cancer pain patients, they took either 60 milligrams of Vicodin in a day versus 5 to 10 milligrams of medicinal marijuana, and the pain relief was the same, and you had less side effects with the medicinal marijuana. You know, Vicodin is an opiate type of medication, narcotic. It can cause addiction problems, withdrawal if it's not taken. It can also cause constipation. And opiates, while they can relieve pain, they can also cause some depression. So marijuana is actually a mood elevator in most patients. So, you know, it can be either just as effective, or it can help decrease the amount of pain medications that a patient takes. Another indication, I think this rounds out pretty much 10, is Crohn's disease. Medicinal marijuana attaches to cannabinoid receptors in the body, which can help decrease the inflammation and decrease the pain and cramping that comes from Crohn's disease, which is a chronic autoimmune inflammatory disorder of the digestive tract, which can be very disabling to patients. But medicinal marijuana, thankfully, can be very effective, and it can help decrease the amount of immunosuppressive medications that people need to take. So there you have it, rounds out the 10 conditions that medicinal marijuana can be very effective for. If you have one of these conditions and you want to be evaluated, visit ArizonaMMC.com, where you can sign up, or call 855-AZ-ID card, toll free, for an evaluation. I'm Dr. David Green.